When U.S. President Joe Biden stepped onto the tarmac in Scranton, Pennsylvania, he met Jen Partyka. See the white note in her hand? She handed that to the president.
I did feel like it was important that he understand that the nurses are not okay.
Partyka has been a nurse for 30 years. During the pandemic, nurses have worked nonstop and are still stretched thin. Partyka lost a colleague to suicide and has seen extreme exhaustion.
We have been absolutely tapped. We have been, fighting this fight. We did not expect it to go on so long.
That has led to a nursing shortage.
I've had a 50% turnover in the past year.
The official recommendation is a 1-to-2 ratio of nurse to patient in the intensive care unit. Partyka says a nursing shortage is making it 1-to-3.
That's the only way you get to go to ICU now, is if you're really, really like the sickest of the sick, because there's no bed for you. So tripling those patients is incredibly, dangerous.
And that has led to burnout in the hospital emergency room.
I was just crying so inconsolably, and I couldn't stop. It was a full body cry.
G, who asks that we only use her first name, had a panic attack while on the job. It temporarily paralyzed her ability to speak and function.
All of a sudden, I couldn't fill out a simple form. My brain was not making connections in the same way.
The nurse became the patient. She now sews scrub caps for healthcare workers as part of her recovery after spending a week at a psychiatric hospital for PTSD. G says she wasn't the only nurse being treated there. As if COVID isn't enough, nurses here in Philadelphia and from several other U.S. cities are facing an onslaught of patients from yet another menace. The murder rate is skyrocketing. VOA spent several hours on the streets with Philadelphia police. This is a double shooting.
I got another one up here, Sean. I got another one up here.
Police regularly load victims into their cruisers instead of waiting for ambulances. Some weeks, the slayings equal the number of COVID-19 deaths.
Every single day is like combat levels of casualties coming through our doors.
Alex Kaspin works as a nurse at a Philadelphia hospital. After she developed a panic disorder, she was moved from the ER to a pediatric floor, which she says saved her life.
There was a point in time where I felt like I was not present for my family. I was giving my all to my patients, but I don't think that there was much left over for me.
When medical work affects a nurse's well-being, experts call it compassion fatigue. The U.S. healthcare system is fighting a nearly 2-year battle with no ending in sight, as nurses leave hospital bedsides and emergency rooms for less stressful work, many carrying their guilt with them.
One way or another, I would not be able to continue with this job. And I loved being an emergency room nurse. I really loved being an emergency room nurse. I think it was my true calling.
Carolyn Presutti, VOA News, Philadelphia.